From pregnancy to your baby's first days, we'll answer your most asked questions about motherhood. I'm Dr. Freddy Gomez and welcome to Medtalk Health Talk on CNN Philippines. Calling all expecting moms out there. In celebration of Mother's Day, our guests are here today to give you practical and effective tips on keeping your baby safe as well as healthy. With us is Dr. May Siki Young. She's an obstetrician and gynecologist from the Makati Medical Center. Also with us is Dr. Jamie Isip Kumpas. She's a pediatrician and lactation consultant from the Medical City. If you often find yourself running on little sleep or reaching for that bag of chips, it's time to make some lifestyle changes in order to give your baby the healthiest possible start in life. Now, eating the right foods and exercising regularly can help ensure a safe pregnancy. Now, I'll start the conversation with Dr. May. Now, let's talk about someone who wants to become a mother, is starting to think of the family. What kind of diet should she think of in order to prepare herself, not just for one, but maybe for two?
This is the most common thing that women take for granted. They go to the clinic and say, Doc, I want to get pregnant, but they're obese, no? So what we do is to assess you, your risk, and tell you what you have to do. Proper nutrition is very important, exercise is very important, and age is also very important. So having the right body and health at the time before you get pregnant is very crucial. Sometimes it will affect the pregnancy.
Many, Dr. May, might feel daunted with the fact that someone becomes pregnant, they would gain weight. They're afraid of that weight, intimidating for a lot of mothers, especially nowadays. But it is normal to gain weight when someone is pregnant. What is a normal spectrum so that our viewers will have an idea on what the normal weight gain is, and of course trying to make sure that you don't go over that expected weight gain?
The weight gain depends on your baseline weight. If you're overweight, your total weight gain should be reduced. Maybe 10 to 15 pounds the whole pregnancy. Your body weight, it will be around 25 to 30 pounds. If you are underweight, it can go as high as 45 pounds. That's why the prenatal checkup is very important. No? But that weight gain should not be because of junk. That weight gain should be because of eating healthy. So like a lot of vegetables ideally, fruits, not so much because the sugar content is very high. So choose well in what kinds of fruit you want to eat.
Doc Jamie, when it comes to the child, what are some of the foods that women should avoid?
We really do want to steer clear from anything that would be processed, and if it comes from unnatural food, then we don't want that. So we always stick to rainbow of fruits and vegetables, so natural food. So the things that's not like that, that's what you want to avoid. So like soda, junk food, processed food, as much as possible. We don't want canned food also. So we really want to stick to the natural food items.
Are there any specific things in the diet of the mother that they should be taking in order to prepare for, a good, nutritious breast milk for the baby?
What's important is really to just be as healthy as you can. But what's beautiful about breastfeeding is even those who are undernourished will still be able to produce breast milk for their babies. So we just want a healthy mom so that she'll be able to take care of her baby. But when it comes to nutrition and breastfeeding, just stick to the healthy food and that should be enough already.
Actually, experts say that gaining too much weight during pregnancy increases the risk of gestational diabetes and high blood pressure. This can also affect pregnant women later on in life. So they're encouraged to do some sort of physical activity every day. And there are also a number of other benefits to it. Dr. May, let's talk about this. Earlier, you mentioned how a good preparation for motherhood is that you start at your ideal weight before getting pregnant. Could you talk more about this? How important is exercise, not just before getting pregnant, during pregnancy, and during delivery?
If you are obese, we would really encourage you to lose weight first because it will affect you and the baby. And exercise, you have to start as early as possible. If you don't have any exercise though and you're already pregnant, what I do is I ask them to gradually increase the activity. So walking, swimming, you can count the steps, no? Because if you don't exercise, aside from you're eating a lot and you don't exercise, and your body will change, you will really have difficulty carrying the pregnancy. That is just the minimum. So the other things that will affect the pregnancy, which will have a bad outcome, is, as you mentioned, Doc, is diabetes, hypertension, which might lead to preterm birth. And if you are very desirous of normal delivery, it might not happen if you have complications.
Enough physical activity can even prevent complications from arising. In fact, the National Institute of Diabetes and Kidney Disease reports that there's evidence that it may reduce the risk of preeclampsia. Doc May, let's talk about preeclampsia. Please explain to our viewers what it is and how common is it here in the Philippines?
Preeclampsia usually happens after 20 weeks age of gestation. It's defined as increase in blood pressure plus protein in urine. The thing about preeclampsia is we cannot really predict who will have preeclampsia and who won't have preeclampsia, but there are risk factors that you can see who will most likely have preeclampsia. So example, you have previous preeclampsia, you have chronic hypertension already, you have kidney disease, you're obese, first pregnancy, multi-fetal pregnancy, your chance of having preeclampsia would increase. So in the Philippines, usually the percentage of preeclampsia is around 4 to 8%, depends on where you are, no? And women who are older will have higher chance of preeclampsia.
Dr. May, earlier you mentioned that preeclampsia is one of the more common complications seen with high-risk pregnancy. Could you please explain to us at what age does a pregnancy start to become high-risk? And aside from preeclampsia, what are other high-risk complications normally seen in Filipino mothers?
So theoretically, high risk is defined at 35 years old and above. Then when you're 35 years old and above, your chances of having preeclampsia is increased, during pregnancy, diabetes is increased, and also some sort of genetic problem. On top of that, the chances of having a cesarean section is also increased. But when I assess the risk of the patient, we don't only look at the age of the patient. Again, we look at the history of the patient, the weight of the patient, the physical activity of the patient. All in all, this will give you somehow a clear view of when you're pregnant, what are the chances of you having complications, including preterm birth and cesarean delivery.
You've gone through pregnancy, labor, and delivery. Now what? When we return, tips on how to care for your newborn. We're your partner in healthcare. You're watching Medtalk Health Talk on CNN Philippines.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao para sa Mindanao. SMC Davao Cement. Ato ni Bay. SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao para sa Mindanao. SMC Davao Cement. Ato ni Bay.
RPN DXKT 1071 sa dial sa inyong mga radyo.
After 9 long months, you're ready to go home and begin your life with your new baby. Now, while caring for a newborn can be challenging, it does become a little easier with the right guidance. Today, what you need to know when you step out of the hospital. I'm Dr. Freddy Gomez, and welcome back to Medtalk Health Talk on CNN Philippines. Many first-time parents may feel overwhelmed. If you're one of them, don't be alarmed. It's completely normal. We're here to help guide you through this process. Now, let's discuss some of the basics. Dr. Jamie, starting with what are tips when handling a newborn? Carrying an infant for the first time can often be nerve-wracking, especially maybe for the father.
You also have to give yourself some time to practice, no? Don't be so scared, but when you do things with a lot of gentleness and just make sure that you support the baby properly, meaning you hold the baby's neck and the head, and then you also try to cradle the baby well. Never carry the newborn under the armpits because they're not yet too strong to be able to hold that position. So always protect the head and the neck and also the back and the bottom. So you have to do it very gently.
Let's talk about changing the diapers. Of course, this is going to be a big part of a parent's daily routine whenever they have a newborn child. But what are some of the tips that new parents should watch out for, especially when changing a baby's diaper?
Actually, just make sure you have a lot in stock because especially newborns, we expect them to have these diaper changes maybe 6 to 10, almost 12 times a day. So we want to make sure that whenever you're cleaning, you use cotton balls with some lukewarm water and always wipe towards the buttocks or towards the anus so that you don't cause any kind of infection. So make sure that when you use a cotton ball and you're wiping away, you throw that and dispose that right after you use it and then just get a new one. So we want to be able to also change as often as needed so that you can prevent diaper rash, because when the stool is in the diaper and we don't get to change it right away, then that is when since the baby's skin is quite sensitive, that is when they can have diaper rash.
Now, another common concern among first-time moms is feeding. Now, there's a lot of information out there on whether you should breastfeed or formula feed, for how long and how often to do so. Dr. Jamie, let's talk about the benefits first of breastfeeding.
The baby's immunity is not well developed yet when they're born. So the mom is able to protect that child by passing on some antibodies through the breast milk. And we've also seen that there's some babies who have lower risk of asthma, allergies, even certain kinds of cancers like leukemias whenever they are breastfed. So we also know that there are also beneficial effects to the mom who is able to breastfeed, such as a decrease in their ovarian and breast cancer risk, even for type 2 diabetes.
There are so many benefits to breastfeeding, but we'd like to point out that not all women can breastfeed. Others need to supplement this with formula. So moms, please don't be so hard on yourself if you need to do so. There's nothing really wrong with that. Dr. Jamie, let's talk about moms who have difficulty or who cannot breastfeed for one reason or another and they need to use formula. Are there any advice moms who are using formula? Is it the same schedule as breastfeeding?
It is quite different, no? There's a very small percentage of moms who are not able to breastfeed. So they really also do need to get some kind of support. So whenever babies are breastfed, usually they don't follow a certain schedule. A lot of babies feed in clusters, like every hour for 3-4 straight hours and then sleep a bit longer. But generally, you do want to feed that baby around 8 to 12 times in 24 hours. So that's for a breastfed baby. For those who aren't breastfeeding, usually you still follow the 8 to 10 times, and you can be a little bit more scheduled when it comes to that. So it's generally every 2 to 3 hours. Around the clock.
Now, before we go to break, Dr. May, immediately after giving birth, there are some mothers who experience a phenomenon of having some form of depression. They call it maybe the baby blues. Is this something that can be prevented? Is this something that is common?
So postpartum blues is actually very common, no? So sometimes after you give birth, you get overwhelmed with everything, especially for first-time moms. They have to breastfeed, they have to recover, they have a lot of things, they still have to run the household. So again, the husband is very important. One thing that we obstetrician can do is to warn the patient to sleep well, to eat well before you give birth so that you have enough energy. Usually postpartum blues are just temporary, you know. You have to feed the baby every 3 hours, more or less. It's round the clock. You don't get to sleep for 8 hours. So that pagod, no, plus breastfeeding, plus recovery can really cause postpartum blues. So the support of the husband is very important. If you have other support system like nannies or grandparents, it would help a lot. But usually postpartum blues is temporary. In case you feel worse, usually we have a follow-up after delivery. Please mention it to your obstetrician because we can assess you, we can help you, and we can refer you to a proper doctor for assessment if we suspect that you're having postpartum depression.
Now, sometimes, through no fault of your own, your baby might get sick. It's vital to know what to watch out for and how best to help him or her. When we return, the most common illnesses among babies and basic first aid for parents. Your health is our mission here on Medtalk Health Talk. You're watching CNN Philippines.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay. SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
RPN DXKT 1071 sa dial sa inyong mga radyo.
I'm Dr. Freddy Gomez, and this is Medtalk Health Talk on CNN Philippines. As a parent, it's easy to feel helpless and worried when your baby is sick. But many of these health problems among newborns can actually be managed very effectively by the parents. First aid and some TLC can go a long way in the recovery of your little one. Dr. Jamie, when it comes to the baby having a fever, that's probably one of the more common things. What are some of the physical characteristics that the parent might see that their baby might do or have if ever a baby has fever? What should they do?
So what we need to do is to make sure that that baby is comfortable. And sometimes it's really about changing the temperature of the room, or what you'll notice with babies is they get very clingy, especially to their moms, because they want to breastfeed as often as possible because it gives them a lot of relaxation, also it gives them a lot of comfort. So those are just some of the things that you do.
Dr. May, earlier we've been talking about how important the support system is, how important the role of the father is, especially whenever there's a newborn baby. The dynamic is very important here. For the men out there, for the fathers out there who have no idea how much involved they should be, give some concrete examples on how much support a father must be in, especially when there's a new baby.
The husband should always understand that raising a child, especially babies, newborn babies, is not solely the role of the mother. So they can help by changing the diaper, let the mom sleep, no? Or sterilize the bottles if they're using formula milk, let the mom rest in between, and they should also wake up because the mom is also recovering. They should also understand that the mom is going through a lot of changes. So just be there. Just listen to them when they cry because they're sad. For some reason, they don't understand why they're crying. Please, husband, be very, very patient because they went through a lot just to have your baby also. So just be there and listen to them and help as much as you can.
Now, I'd like to talk to Dr. Jamie about some basic first aid when it comes to the baby. An advice, though, to the viewers here, first aid is best done if you are very familiar with trying to find out what are the warning signs that the baby does need first aid, and you have to have that skill in order to perform first aid. With that being said, Dr. Jamie, what are some red flags that the baby does need some first aid when it comes to maybe their breathing or their swallowing or the sounds that they make?
Actually, if you're taking care of your baby right on a daily basis, you're very familiar with how your baby is acting, the usual sounds that your baby is making. So anything that deviates from that, then you start to monitor and check. If it's something acutely, like if, for example, your baby is suddenly choking on something, then you will notice that there's some children who will actually turn blue right away if it's very quick, which is choking episode, no? But there are some times wherein it's not a complete obstruction and they can make these like very high-pitched breathing sounds. One thing that I also want to point out is that many of these accidents are actually something that can be prevented. So you want to make sure that you child-proof your home quite well so that we can prevent them. So if babies are in that stage where they're putting things in their mouth, so you want to make sure that that whole area where they're at don't have small items that can be choking hazards. Also, if they start crawling already, you want to make sure that you're closing all of these plugs, sockets, so that they don't get into these accidents. So a lot of these moments are really preventable.
Before we go, Dr. May, do you have any tips, advice for the viewers out there, especially those who are thinking of having a family for the first time?
For me, pregnancy and giving birth is really something very beautiful as long as you are ready and you are also ready to the changes that you have. And please talk to your husband because this is a journey that two of you should go through, and always have a checkup. Please have a regular prenatal checkup.
And Dr. Jamie, before we go, any advice from you?
For me, I think what would really help a lot of new parents would be to take classes prior to giving birth and prior to taking care of the newborn. Aside from gaining knowledge, it also gives you a little bit more confidence and you feel that you're ready to take care of the newborn. But of course, give yourself some time to get used to being new parents and enjoy the journey. It really goes by so fast.
From the first week of your pregnancy to time with your newborn, remember, moms, to always care for yourself. A healthy you means a healthy baby. Thank you very much, Dr. May Siki Young and Dr. Jamie Isip Kumpas, for being with us today. We appreciate your time and your insights. I'm Dr. Freddy Gomez, and we'll see you again next time on Medtalk Health Talk.